I'm joined this morning by the Deputy Premier, who will be giving us some news on the regional areas, that is some positive news, and Dr Gale, who will be talking about some of the other issues that need to be dealt with in detail on health. So I start by advising that there were 1,351 locally acquired cases here in New South Wales to 8 p.m. last night. There were no overseas cases. Test-wise, there were 129,266 tests to 8 p.m. last night, and I would encourage the community to continue to get tested with any symptoms whatsoever. Health needs that information in order to be able to make the decisions that are undertaken to make us or keep us safe. The vaccination rates: New South Wales administered 29,976 vaccines in the period to 8 p.m. last night, 24 hours to 8 p.m. last night. There were 4,721 vaccines administered at Sydney Olympic Park and 6,254 at Kudos Bank Arena. Across New South Wales, 80.1% of the over 16 population has received a first dose of COVID-19 vaccine, and 48.5% of the entire community over 16 are fully vaccinated. Just want to thank the community for coming out in such strong numbers to be vaccinated, because there's now almost 8.5 million people in New South Wales that have had the vaccines administered to them. The cases in hospital: there are now more than 15,000 people with COVID-19 who are being cared for in our New South Wales health system. The majority of those, over 90%, are being cared for in the community, at home generally, and some are in the New South Wales Health special accommodation. Dr Gale will give more information in regard to that. Sadly, 12 people passed away up until 8 p.m. last night. There were 6 ladies and 6 men. These people were in a range of ages, and I just want to stress that the range of the ages reflects the fact that this is a very severe disease and can impact you at all ages. And for those who are still reluctant to go and get vaccines, can I say that is the way forward. You need to go and get vaccinated. 1 person was in their 40s, 1 person was in their 50s, 4 people were in their 60s, 2 people were in their 70s, 3 people were in their 80s, and 1 person in their 90s. And I want to stress that of those 12 people who passed away, 10 people were not vaccinated. 10 of those people were not vaccinated. I want to express, it's just, whenever we lose a family member or a friend, it impacts on every one of us. And I just want to express my condolences, and I'm sure all the condolences from New South Wales Health. Staff there care for each and every one of these people. And my sympathies go to all of the family and friends of each of these people who've passed away. Dr Gale will give more information in regard to those cases as well. In terms of the regional areas, there was 1 case in northern New South Wales to 8 p.m. last night. In the Illawarra, there are 44 new cases reported in the Illawarra. That brings the total in that particular local health district now to 502 cases. 21 cases are from the Wollongong local government area. 20 cases are from the Shell Harbour local government area. 2 cases are from the Kiama local government area, and 1 case is from the Shoalhaven local government area. In Western New South Wales, there have been 27 new cases reported to 8 p.m. last night. This brings the total to 1,004 cases in that area. Dubbo had 12 cases, Bathurst had 6, Walgett and the general region had 6, Burke had 2, and Wellington had 1. In the far west of the state, there were 2 further cases in Broken Hill. In the Hunter, there were 16 new cases across the Hunter New England Local Health District. This brings the total to 367 since the 5th of August. Of those 16 new cases, 6 are from Lake Macquarie local government area, 5 are from Newcastle local government area, 3 are from Cessnock local government area, 1 is from Gunnedah local government area, and 1 is from Port Stephens. On the Central Coast, there are also more cases. 23 new cases have been reported in that area, and that brings the total in that local health district to 312 cases. In the southern New South Wales area, there have been 3 new cases. One of those cases was in Yass, 1 in Jerrabomberra, and 1 in Queanbeyan. In the Southern Highlands, there have been 2 new cases. I'm going to ask Dr. Gale now to give further information on the relevant cases, but I also want to just finally say that there is some good news, which, as I said before, the Deputy Premier will go through the local government areas that are coming out of lockdown. But there are 2 areas that unfortunately will have to go into lockdown. One is the local government area of Lismore, and one is the local government area of Albury. Dr. Gale will give a little more information on the basis for that, but suffice to say there have been positive cases in both areas. Can I say that express my sadness to the local community that having been free of that for a little while, having to go back into lockdown, but it is for your safety and for the community's safety more broadly. That lockdown will occur as from 6 p.m. today. Health has made a decision that the period of lockdown initially will be 7 days. Now, the reason for that is to try and get a handle on what exactly is going on in the local areas. In the normal course, more often than not, health determines that it will be 14 days, but in this case, looking at the issues, health has determined that 7 days will be appropriate, but I'm just warning the community that it may be longer. We really need each and everybody in those 2 communities with any symptoms at all to come forward and get tested, because that will allow health to make well-structured decisions based on the information that's available.